Well, another dangerous type of cancer is, of course, skin cancer. And summer is here and everyone's breaking out the flip-flops and swimsuits. But exposure to the sun can be bad news for your skin. We've all heard what we're supposed to do to protect our skin, but what about when it's already been damaged? Dr. D.J. Verret is a Dallas-based surgeon. You've seen him here before. We're happy that he graced us again with his presence. We appreciate that very much.
Well, thanks for having me.
Because, you know, quite frankly, women in their 50s, 60s, 70s, for some of those ladies, there was not a way to prevent skin damage, and quite frankly, you didn't know there was a problem.
Absolutely. I see a lot of patients in my practice, both men and women, who said that they used to soak themselves in Crisco and go outside and sunbathe. It was a very common thing, so they weren't protecting themselves.
Right.
So the question always becomes, what can you do on the backside once the damage has happened? And there are actually several areas of treatments. We have three major ones that we talk about. We talk about topical creams, such as the retinol, the vitamin A derivatives, the hydroquinone derivatives. We also talk about chemical peels, laser resurfacing, and then a couple of surgical solutions as well, such as facelifts and other kinds of things to take out the wrinkles, basically.
Well, let's go through some of these. First of all, you're talking about ointments.
Right.
Is what I buy at the drugstore, anybody buys, is that strong enough to really make a difference?
Well, in some cases it is, but in others it isn't. Take the vitamin A derivatives, the retinols or the retinol esters. And you see those over the counter, but they're also available by prescription. The prescription ones have been shown in numerous studies to be much more effective than the over-the-counter ones. Now, the downside to it is you often get what's termed the retinoid reaction, which is a redness and a dryness to the face. It lasts about a month, but once you get over it, you're done, and you actually get very nice results.
And what are we looking at here?
What we're looking at here is actually a laser resurfacing procedure that on a patient of mine, and this is a carbon dioxide laser resurfacing, and it's done obviously on an awake patient, and it's used to treat both sun damage from wrinkles and pigment. And as an added side effect, it helps to take away some of the precancerous skin cells that we see on the skin that can lead to bigger problems later on in life.
Anybody watching this is going to say, does that hurt?
Well, we put numbing medicine on, and I would say bang for the buck in cosmetic surgery, the carbon dioxide laser resurfacing is probably the best thing you can do.
Okay, and then your third option is what?
And then your third option are chemical peels. And there are three different levels of chemical peels that we talk about. Superficial peels, which you can buy over the counter. These are the glycolic acid or the alpha hydroxy acid peels.
Okay.
They help to exfoliate the skin. Medium depth chemical peels help to take away the pigment of the skin. These are trichloroacetic acid, TCA peels. And deep chemical peels, which help with the wrinkles on the skin, generally phenol and similar substances. Now, a quick word of warning, though, because these are chemicals and they aren't medications, any of your viewers can go on the internet and actually buy these chemicals and try to use them at home. Very bad idea, though. They should only be used under the supervision of a physician who is familiar with these treatments.
Well, we appreciate you making the trip from Dallas. You always have new information. We appreciate that.
Well, thank you so much. Pleasure to be here.
Thank you.